Thank you for the organizing committee for letting us present our paper on the anatomical concave surface area or the AXA method, which is a 3D quantification of glenoid bone loss and shoulder instability. I'd really like to thank my co-authors for this study, as the study has been conducted in Quasar. These are my disclosures. So, shoulder instability is one of the most common conditions which we see as shoulder surgeons, and often we see that it's associated with some degree of glenoid bone loss. Accurate estimation and measurement of glenoid bone loss is really important because this guides us whether or not to proceed with a soft tissue procedure or to undertake a bony procedure such as a Bristow or a Latarjet or an Eden-Habinet procedure. Traditionally, bone loss is quantified by two techniques which are the most widely used. It's the best circle fit method as popularized by Dr. Sugaya, and the glenoid height and width method as popularized by the team in London, Ontario, by Josh Giles and co. These are the two most widely used methods, and I, in my clinical practice, have been using these methods till of late. The bone loss by the best circle fit method is basically a percentage of loss of this best circle area as a surface area method, and the bone loss percentage is calculated as the percentage based on width versus the calculated native width. Now, this is how I would have traditionally drawn the best circle fit on a 3D on-face view, which is what we get. And one of the things which has always alarmed me is that this is a 2D surface area which we're trying to quantify in a three-dimensional structure. So if I actually draw the best circle fit and zoom this in, we can see that it's the best circle fit. Even though it looked perfect on a 2D view, on-face view, doesn't even touch the glenoid surface, and it's not a representation of the glenoid concave surface area or a 3D representation of the glenoid at all. The second question which beckons is, which is the best circle fit? Is this the best circle fit? Or is this the best circle fit? Or is this the best circle fit? The diameters of all the three circles are totally different. Thereby, the percentage bone loss which we'll calculate by this is totally different. And as there are different projections of the CT scan or the 3D model which have been used to devise these circles, the measurements will vary. So, what we try to hypothesize is that if we look at the current ways of measuring bone loss, these are all 2D constructs on static images, and they misrepresent the 3D anatomy or the concave anatomy of the glenoid fossa. So we hypothesize a more reliable method for estimation of bone loss would be actually to look at the 3D concave surface area of the glenoid so that we can quantify the bone loss in a 3D measurement. The objective of the study was to quantify the anatomical concave surface area of glenoid bone loss using 3D segmented models. We call this the AXA method, and comparing the AXA method to the best circle fit and the glenoid height width methods, which is what is clinically used. So in step number 1, we took bilateral CT scans, and this was the hardest bit of finding a patient who had significant bone loss on one side with a normal shoulder on the other side with no previous surgery on the other side. Then we mirrored the normal side onto the abnormal side to create two symmetrical models, and then they were masked one on top of the other with a contralateral overlay so that we could calculate the percentage of bone loss. Then we marked the inferior rim of the glenoid with 10 concentric points, and then this by custom code generated a circle for which the center of the glenoid was calculated, and a sphere was calculated based on this circle. This circle was then overlaid onto the contralateral or the abnormal side, and we were able to calculate the percentage bone loss based on the AXA of the healthy minus the pathological divided by the AXA of the healthy. So we had 36 pairs of scapula, which we used for the study. And what we found was quite interesting. We found that if you look at the concentric surface area or the concave surface area, the percentage of bone loss is actually much less than what the best circle fit method or the glenoid height and width method are. So a 14% bone loss by the best circle fit method only equates to a 9.4% bone loss. And this was statistically significant. We also did an interclass correlation coefficient to see whether we were calculating the best circle fit, the glenoid height and width method, and the AXA, and we found quite a lot of inter and intra-observer reliability with our ICC measurements of almost 0.9, meaning that this method, because of most of it is derived by custom code and an algorithm, is quite reliable, and there is less chance of an error between two different users doing the measurements. Thus, to conclude, we think that the glenoid bone loss estimation using the AXA method is less than that which is calculated by standard 2D techniques. The results are in accordance with previous findings, demonstrating that the diameter-based glen loss calculation overestimates bone loss. And we believe that the AXA method showed better inter-observer reliability as it's more reliant on algorithms. These are the references, and I thank you for letting us present this paper.